On mental health, we know that young people and people living outside of the major cities are at risk of suicide, higher risk, and in fact there have been warnings that they will be the most impacted in the coming years. Was there any conversation in National Cabinet about that? And also, if I may, was there a push from the states and territories to relax the 10 Medicare subsidised rules under the existing mental health care plans?
No, but I'll allow Christine to, because Christine joined us for today's conversation, but I would stress, particularly with the impact of the unemployment statistics we saw yesterday, we're very conscious that burden of unemployment is disproportionately affecting both women and younger people. And that is why it's so important we move quickly. I mean, one of the points Christine made today in response to issues that were raised is that the more we're able to reopen the economy, that's also good for the mental health of young people, to provide that hope and that opportunity and to provide some certainty in what is otherwise a very difficult situation. Christine?
Yes, thank you, Prime Minister. And really good question, because we do need to be very careful. So within the constraints of saying that I think any conversation about our suicide risk for any Australian needs to be very carefully managed as we go through, because we want to actually concentrate on what can we do to ensure it doesn't happen. So was it an issue? Absolutely, it's an issue. It's an issue every conversation that I and others have when it comes to looking at the mental health and wellbeing of Australians as we go through COVID-19. So it is of great concern. But as I say, the issue is very much about saying, how do we stay ahead? How do we try and ensure that those connections are there? How can we try and ensure that we reach people? Now, Reach Out we've looked at their figures, because they are a place where young people go, and particularly for rural, regional, remote areas where they need to access services which they can't do face-to-face, and a young person is looking for something. There's been over a 50% increase in young people accessing Reach Out's services and looking at what's there. So we know that young people are concerned, we know that this is impacting on them, and we know the risks. We do know the risks. But our challenge is to make sure that we have open access for them to look for help, that, as the Minister has said, the fact we will have a comms campaign which will really seek to normalise help-seeking behaviour. That's something we've really got to get to, and then we make sure that we connect with them. All of those are really critical.